Response to Intervention by Maria Aleman. What is RTI? RTI is not a specific program or type of teaching, but rather an instructional approach that serves two purposes. First, it provides early intervention services to struggling students to improve their academic or behavioral skills. Second, it is an option that can be used to identify students who have learning disabilities. This presentation will focus on the first purpose, early intervention services for academically at-risk students. The key ideas associated with RTI include 1. Multiple tiers of increasingly intensive levels of instructional interventions in the core content areas is used to efficiently differentiate instruction for all students. 2. High-quality, research-based instruction is provided at all levels in the general education classroom. 3. Frequent progress monitoring allows educators to make informed decisions about the effectiveness of the intervention and to tailor the intervention to meet student needs. 4. Data-based decision-making on which types of interventions to use. The goal of RTI is to be proactive as soon as students begin to struggle, intervening immediately to prevent learning difficulties. Tier 1 is core classroom instruction for all students. It is preventive and proactive. Approximately 80% of students are successful with Tier 1 supports. Tier 2 is targeted small group instruction for at-risk students. Tier 3 is individual intervention for students provided at high intensity for approximately 9 to 12 weeks. Tier 1 is core instruction for 80 to 100% of all students. The RTI process begins with the teacher assessing the academic skills of everyone in the classroom, known as universal screening. Universal screening typically occurs 3 times per year. This determines which students need instructional interventions. Interventions can be part of classroom-wide instruction, or students may be broken down into small groups of different skill levels, also known as differentiated instruction. Progress monitoring usually occurs on a monthly basis through formative and/or summative assessments. Examples of Tier 1 interventions include proximity in order to increase students' time spent on task and redirect attention for distracted learners, and modeling to develop academic language, build transfer skills, and develop content knowledge foundation. Tier 2 is supplemental instruction for 10 to 15% of all students. Within Tier 2 are students who have been identified through both formative and summative assessments as needing more support. Students are usually placed in small groups. These groups are formed based on specific skills not mastered from Tier 1 instruction. Since they are formed around skill mastery, these groups are temporary and meet about 3 to 4 times per week, only until a specific set of skills are mastered. Since Tier 1 instruction was not mastered, students at this tier need totally different interventions. These interventions are in addition to Tier 1 instruction. Progress monitoring usually occurs on a weekly basis through probes or mini-assessments. Examples include explicit instruction in decoding, practice in reading fluency, hands-on and explicit instruction in whole number operations. A very small percentage of the class, 1 to 5%, will require Tier 3 support. Instruction is provided daily one-on-one or in very small groups that may include special education students who are working on the same skills. Interventions at this level are intensive and highly focused on targeting the specific needs of the student. Progress monitoring typically occurs 2 to 3 times per week through probes or mini assessments. The student remains in the general education classroom but is instructed by a special educator or a reading specialist. If adequate progress is not made in Tier 3, an evaluation to determine eligibility for special education services is appropriate. Examples include fast-paced lessons with good modeling followed by very focused guided practice. Reading recovery is such an example. The advantages of RTI include allows schools to intervene early to meet the needs of struggling learners. It can increase the number of students who are successful in general education classrooms, as well as reduce the number of students who are referred for special education evaluations. Progress monitoring is much more frequent at Tiers 2 and 3. This data and documentation specifies which interventions have been successful and which have not. If a school applies RTI practices with fidelity, a vast majority of students will never need to be referred for special education evaluations.